I wanted to talk about the work we're doing with the BC Coalition of Nursing Associations towards amalgamating into one association. And in particular, one of the things I wanted to talk about was the name and where we came up with the name Nurses and Nurse Practitioners of BC. Sometimes that's a question that's come up in some of the consultations we've done. And I think it's important for people to have an understanding of how we came to that decision. First of all, around our coalition table, there was a lot of discussion about names and what we should call ourselves. And we had debates about various names and acronyms and what sounded good and what might not sound so good and what could work and what names are available in terms of domains and all of those usual sort of things. But one of the things that became apparent during our conversations, of course, was that language is really important and there is something to a name. And nurse practitioners in this province are still a really new entity. We've been here for 12 years, and although 12 years seems some days like a really long time, it's actually not a very long time in the grand scheme of the healthcare landscape. And so there is not a day that goes by in this province when a nurse practitioner has to explain to someone, a patient, a colleague, a stakeholder, a member of the general public, what a nurse practitioner is. I'll give you an example. When an RPN or an LPN or an RN will walk into a room and tell the patient, I'm your nurse for today, there's generally an understanding on the part of that patient as to what that means. Now, they might not understand the exact details of the scope or what exactly the work's going to entail, but they do have a general idea of what is going to happen in that interaction with a nurse. But when I walk in a room as a nurse practitioner and I say I'm a nurse practitioner, the patient then generally does two things. One is there's a blank stare, or two is they say, oh, like a licensed practical nurse. In both of those cases, I then go on to explain, no, actually, here's what a nurse practitioner is. And that's really important because it's very central to the interaction that's about to take place. So what I usually say is something along the lines of, well, I'm a nurse that I went on to do graduate clinical education, and now I am licensed to practice in order to diagnose medical conditions and send you for tests, send you for blood work, send you for other diagnostic tests, refer to specialists, prescribe medications, and generally manage your medical care. And that is really, really not something that most patients are expecting. And every day in this province, that conversation happens. And every day in this province, those conversations happen with other people as well, stakeholders, as I've said, other healthcare colleagues, and the general public. And so even though it's been 12 years, it's still a very significant issue in terms of the lack of awareness of what a nurse practitioner is and what that means for healthcare. And so when we had those conversations around the coalition table, our nursing colleagues really recognized that that was truly an important thing. And one of the key guiding principles about the work that we're doing, and as we amalgamate, a key aspect of our work together is to support one another and to really help each other to advance our respective designations in terms of professional practice and in terms of professional issues. And so it is really a professional issue that nurse practitioners have in this province that still today they need to explain who they are. And so I'm really happy that the nursing colleagues around the BC Coalition table felt that that was very important, and we came to a collective agreement very easily, actually, when we started discussing it, about the fact that we really see having nurse practitioner in the title as a very important way to show the support and to continue to raise awareness